Hello, everybody. I'm Dr. Steve Karstensen, Chief Dental Editor of Dental Sleep Practice Magazine, a MedMark publication. Welcome to an educational discussion and Q&A with Stan Jones. In our webinar today, we'll be covering the systems and processes for becoming credentialed with medical insurance. Before we get started, I would like to invite viewers to use the chat box on the right side of your screen to ask any questions. Your questions will be answered at the end of the session. Now, I'm pleased to introduce our guest for today. Stan Jones is a certified dental assistant and a dental lab technician, but I always call them lab artists because that's what they do. He has over 25 years of experience coaching dentists and their teams. Stan's extensive knowledge and on-hands experience in the implementation and practical application of dental sleep medicine and specifically oral sleep appliances in the modern dental practice make him a highly qualified Nexus Dental Systems DreamSleep instructor. So, Stan, I look forward to hearing what you have to say. Everybody asks when I talk about to dental groups about medical billing. So this is going to be powerful information. I'm so happy that you're here. Welcome to Dental Sleep Practices webinars.
It's good to be here, and we appreciate the opportunity to share today. Medical billing is probably one of the biggest things out there, especially dealing with oral sleep appliances and dental sleep medicine. So I'm just going to kind of just go ahead and jump into this. One of the things that we want to say this is that what we're going to be talking about today is medical billing credentialing to help you be in the right position. A lot of dentists, when they start into dental sleep medicine or start offering medical billing, begin to bill for different procedures, especially we're focusing towards the oral sleep appliance and again, the dental sleep medicine, is that they're thinking that if they're credentialed with the group that we're talking about, two groups we'll be talking about today, that they're on the dental side, but they also need to be on the medical side. This is probably one of the biggest mistakes that dentists make. And then the next part of that is that they do become credentialed to be able to accept and to file claims and to be accepted through insurances. But then what they do is they don't continue to maintain that. And certain parts of that need to be maintained are not updated. And what happens is they file claims and then they wonder why it's not going through and why it's being rejected. So I represent Nexus Dental Systems. I'm with DreamSleep. DreamSleep, I'm their trainer, I'm their coach. I mentor a lot of dentists all across the United States with our different clients. And I basically go to their offices. We offer an online 16-module online program. And then a part of that program is we come to that dental office and do 2 or 3 days of training, on-hands training, actually work with the team. And then we continue to give support and coaching, monthly coaching, weekly coaching as needed. And we see a lot of success with this program. So moving forward, there's my picture again. I do get asked a lot of times, people say, do you play Santa? Actually, I really do, actually enjoy it and everything. And I appreciate the introduction that you gave me. So let's jump right into this. The goals and objectives we have here is who sets the standards? What are the 3 W's of credentialing? What is CAQH? If you've never heard of CAQH, we'll talk about that. Availity, other payers, credentialing versus contracting. And then we're going to look at the steps to file credentials and then steps to maintain that. That's the part I was talking about just a little bit ago, maintaining that credentialing. Okay, so who sets the standards for this? Well, the National Committee of Quality Assurance, or the NCQA, has been established to set standards that currently act as a guideline on how credentialing, for care providers. And they're the ones that make sure that every dentist or doctor, whether it be medical or they be a dental doctor, that their credentials are in place and that everything like malpractice insurance and various different things, it just adds a level of quality to make sure that each provider, each dental or medical provider has the right credentials. Now, what is credentialing? Credentialing is the healthcare industry standard to collect and again to verify a care provider's professional qualifications. In other words, are you qualified to be able to offer that particular treatment or that therapy or that care? And that's something that's very important. If that's not in place, then when you go to file a claim, whether it be that a third party provider is doing that for you, or you're doing your own medical billing in your office, it can be determined whether it holds up that claim, the claim is rejected, or if it's moved along a process in a speedy time. Why is credentialing important? Basically, for what I just said, so that they know that you have the right licensure. You have your license, your credentials, your certifications, and that this is all done to make sure that provider has the credentials required to provide that care for that patient. It's just a verification. When does credentialing or re-credentialing occur? That's a really good question we get. Credentialing should occur before the provider begins billing you medically. A lot of dentists will get into dental sleep medicine and they're like, okay, we're going to file a claim, and they do, and it's rejected, and they don't know why. And it's because they don't know who you are. They don't know if you really are a dentist, if you have they want to know your MPI number. They want all these credentials and all these documents to be shown that you know what you're doing. Recredentialing is usually done approximately every 3 years, depending upon the payer's regulations, and that depends on whether you're going to be working with CAQH or you're going to be working with Availity or with through that particular insurance provider. So let's look at CAQH. CAQH is the pinnacle. It's what branches out to all other areas of this, and you'll be talking about. This is why we're focusing on this today. The Council of Affordable Quality Health Care is what that stands for, and it refers to a process of practitioners basically self-reporting demographic, education, training, work history, and various other things. It's electronic access. It allows electronic access to this information to be meant to reduce the burden of paperwork by eliminating much of the paper-based enrollment, and it helps dental insurance and medical insurance and various other ones to be able to pull from this one source and to be able to say, yes, that dentist is qualified. That dentist does have these credentials and they are able to provide that care. Now, I want to say something right off the bat. Being credentialed is not the same thing. We're going to get into that in a minute. You say, well, I'm qualified. I have a CAQ number. I've been registered with CAQ for dental. Well, you also have to do that for medical if you're going to find medical. And a lot of dentists are like, oh, we've already got that done. No, you have to have it for dental and for medical, filing medical. So let's take a look at how this all fits together. CAQH is a portal. And what we look at this is a series of nets. We have a larger net, a medium-sized net, and then a smaller net. We're going to explain each one of these. CAQH is what we consider the big net. Okay, it's a portal that verifies information pertaining to that provider. This includes all-encompassing their license and everything. And this is where most all of your major providers like Blue Cross Blue Shield, Aetna, and some other big name insurance companies that are the ones we see out there. These are the ones that most of the time they go, they're registered, and they pull from that to verify. But we'll make this note here that this process takes about 45 to 60 days. So that's something that if you've not done this, you need to get on board with this. And as we're going through this, I want to go ahead and mention this. We will be more than glad to provide this complete PDF of this presentation to you. All we're asking doctors is that you would provide us with your name, good phone number, and a good email address where we can contact with you, and we'll be more than glad to share this with you because there's a lot of information that we're going to be covering here. CAQH is that large net. It holds that most payers, like we said, that look for verification in one centralized location. They don't want to be, they don't want to go through their own process. They just want to go to one place, pull your information, and be able to say, yes, this doctor is qualified. Now, Availity is it operates as a healthcare information technology company. They do the same thing, but it's another layer. Okay. And somebody says, well, are you going to talk about CAQH? how to be registered and credentialed with them, and Availity. We're only going to cover CAQH, and this is the reason why. Because when you go to register with Availity, it's a lot simpler, and the first thing they're going to ask for is your CAQH number, and they're going to ask for that. And when you provide that, the rest of that process is very easy. So I want you to see it starts with CAQH is that larger net, that larger pinnacle, and then it spreads out. And most Availity serves a lot of different clients in the U.S. and basically Blue Cross Blue Shield, Aetna, etc. We have here the register. You can register with them at their website, and again, we'll be more than glad to send this to you. Okay, and they're that again that medium-sized net. So, and again, a lot of times, and I'll go ahead and let you know, Blue Cross Blue Shield uses Availity, but we need to have that CAQH first. Okay, and you need to have, and like I was saying, you need to have that CAQH part number, that verification number, to be able to register with Availity. Okay, and then there's other payers. When we mean by other payers, there are other smaller insurance companies. Let me give you a good example of that. Out in Vegas, Las Vegas, with the casinos and the gaming and everything, if a person works there for, say, 32 hours and they qualify for full time, then they must provide insurance benefits for their employees. Well, unfortunately, a lot of times, not all, but there's many that I've run into over my years of experience that those particular insurance companies are not providing very good. They're just not good care. The deductibles are high. They don't cover a lot of basic things that we would expect to see in some of our other providers. Now, you need to find out what their application process is. It may be simple as filing it online. It may be paper they have to send to you or something you can fax back to them. But find out what that is and work through that. Make sure you know the credentialing process for that payer. Remember, it can take up to 45 to 90 days for that particular process to go through. So let's address this. I mentioned it earlier. Credentialing, contracting, two different things. Okay. A lot of dentists say, well, I want to get in network. I want to contract with that provider, this provider, insurance provider. Credentialing is the process of obtaining, verifying, and assessing the qualifications of that practitioner. You're voluntarily giving your documents and all of your information so that they can say, yes, you're qualified. Contracting, it requires you to write off above the allowed amount that will be allowed, and fees will be limited to what they allow. Okay, and gives you access to treat HMO patients at different levels. So that's a difference between entering contract and being credentialed. Credentialed first, so that when you go into that process with the insurance company, it makes it easier. Okay, and here's some of the information you would need to download to have access to state license, your DEE license. If you anesthesia, that would probably not apply. Malpractice insurance, things of this sort. Okay. But I tell you what we're going to do. Here's this free little bonus we're going to throw at you. If you'll provide you provide us some named doctors, you provide us with a good email, a good phone number that we can contact you, we'll send you our credentialing checklist. We have a nice credentialing checklist that what you can do is fill out everything. So when you go online with CAQH, which we're going to walk through that process in just a minute, when you walk through that, you have everything ready to go, and you'll know that you don't have to go save and come back. You can just do that process in one flow. It's going to be a lot easier. So there's 2 steps to file credentialing. Gather your information, just like we were talking about, before you start, so you have everything together and you're not looking for anything, or I don't have that, I have to come back. It's a lot easier to do it all at one time. Then we register with CAQH. This is done online by uploading those documents. Now, let me go ahead and give you a hint ahead. PDF is what we're looking for here. It's the easiest. So whatever documents that you have that will need to be uploaded, if they're put in a PDF format, they'll be easier to upload straight to the website. Okay? So here we go. To keep all your practice information, such as your license, DAA, and other information, it needs quite a bit of information in order to tell medical or dental insurance companies that you're a legal provider of service. So remember this, once this is completed, you will need to maintain this and have maintenance on it, the information, but not to re-enter it every time. Keeping a note on your practice management schedule will help remind you to confirm these things. And also remember, it has to be updated annually. You know, like if a DA license goes out every 2 years, and if it runs out, I'm going to go ahead and talk about this right now, and I'll mention it again later. If any part of your credentials or any part of this information lapses, it's not updated, it's not redone, and it runs out, that's when your claims are going to start not being rejected. So stay on top of that, and you won't have any problems with your claims being rejected or anything being questioned or saying, hey, you don't qualify. Okay? So let's talk about step one, create an account. So for every dentist, DDS or DMD has been issued an ADA. The American Dental Association gave you a number, okay? And if the doctor does not know their number, and I'm speaking to dentists, but I'm also speaking, there's possibly some office managers here that you take care of this for the dentist, okay, your doctor. If the doctor doesn't have that number, there are two options. You can use that orange chat box right there as you can see it, or you can just give them a call. To tell you the truth, sometimes just give them a quick phone call is the best way for you to find that. And then we have your website down here for the ADA.org, and you want to go digital, and that'll send you over, and you'll be on the right page. Okay, it'll basically come up. It'll look like this, and if you look over in the right lower hand corner, that's where you're going to want to be, is credentials. Now, what I'm getting ready to show you is that if we make sure all the credentials are correct in the ADA, you're going to get permission from the ADA to send that information over to CAQH, and it'll make it an easier process. Okay, so you add your credentials. Down here it says that, you know, we would go through, put everything, you would submit your credentials. Again, there's that long list of all the things that we might want to think of, and we'll be more than glad to send you our little sheet that we have on that. Okay. Now, authorization. Now you can authorize the ADA to release, like I just said. You say, okay, well, I've entered in all my information, all my credentials, PDF format. Now I'm going to go down, and if you go down at the very bottom on this particular page, it'll just follow as you click, move ahead. It'll say proceed. You click that, and what you're doing as you read those terms and conditions is saying, yes, I would like for that to be sent, you know, to CAQH. Now, once you have authorized the relationship between the ADA credentials and the CAQH ProView, and ProView is where you're going to stay at from here, and during that process, you'll get started on CAQH ProView verification, and you just click get started. Now, I want to say something here. This is something that we can help you with. If you're already now doing dental sleep medicine in your practice, we would love to give you an evaluation of the, you say, well, we think we're doing a pretty good job, Stan. Great. We don't want to scrutinize you. We don't want to judge. We just want to say, hey, is there a possibility that we can help improve that process and help you to be able to help more patients, to be able to do more appliances each month? We would love to do that evaluation and see if we can help you. Okay. Also, too, for all of our clients that are DreamSleep clients, we actually give you help with this process. Okay. And I'll be more than glad to do that. Throughout the system, just some tips we want to give you about ProView with CAQH is throughout the system, required fields are indicated. It's a red asterisk. Okay. If you need assistance, you get lost, you get confused, there's a little question mark that you can, on the right side of the screen, you click it, it'll help you with where you're at in that process, or you can search a question. Use the save, go back, and save continue, which is what we're saying in number 4. Okay. Is save. You've heard it. Save your information or you're going to lose it. So if you save it and you've done all that work and you didn't save it, and you said, oh, well, I don't have this document, and you went back, well, you just lost everything that you had. So make sure that you save as you go. Okay. 5th step, CAQH profile information. We are now on the medical and the dental insurance side of credentialing. Remember, just because you are registered with CAQH as a dentist for dental does not mean you're automatically medical. That's what we're doing now, is for medical. Okay. When you move forward, you're not going to go to the AD original site for updates and attestation. This will be done through ProView at CAQH.org. Because remember, we sent that authorization, we sent all that, and now we're moving through that process. Okay. Now, just a quick summary. Now, the profile, this is some things you'll see, and they'll be at the bottom of the screen. We'll look at that in just a second. Profile summary provides a summary of the key profile information such as CAQ, provider ID. That's what we're aiming for, is for you to get that ID number, an account number. You're establishing an account with them. You can also go here and change your password in the future if you wanted to. Message Center displays different various messages that might be sent to you about, hey, we're missing this document, or this is getting ready to expire, or something like that. Supporting documents, providers links to any supporting documents that have been updated. So if you're saying, well, how's this process going? Do I get an update? If you go to supporting documents, it will show each one as they are approved and how you're coming along with that process. Okay. Attestation history provides a record of that, and basically in that term is just saying it's that you certified that I say to the best of my knowledge that this is truthful, this is correct, and you sign that and release it and everything. Available imports, that's another option. So as you can see across the bottom of this screen, that's kind of how it looks, and you just click on whichever one that you want to look at. So number 6, profile data required. Now, when you go over there and click on profile data required, it's going to have a complete breakdown of everything they're going to ask for, and you can look to see if you've got that and it's in there correctly. Okay. Now let's go over this. Let's step through this thing one more time. Okay. Number 1, create your account on the ada.org /go digital. Contract the ADA. Contact them if you spelled that wrong. Caught that. If you do not know the provider's ADA number, if you don't know your ADA number, you can look it up. All right. Number 2, add your credentials, including uploading the required documents, license, so forth. Remember, we said PDF is the best way to go with that. All right. Then you go to number 3 is authorize the ADA to release that information to CAQH and vice versa. This means updates that get made to CAQH will go to ADA, your ADA file. Okay. They kind of work together. And the ADA encourages that, because they understand dentists need that, dental or medical. Number 4, it will send you to ProView. Moving to ProView with CAQH from your ADA registration. This moves you into not only dental, but now medical, which is what we're really aiming for. Okay. Number 5, the CAQH information. There is information that CAQH ProView will need to finish your credentials. So you'll provide that and everything. And then 6thly, provide the data needed. Make sure you have 3 professional references. That's going to be one that's on that list that and they're going to ask for that. So go ahead and get that in line. All right. So once you've done this, you've submitted it, it's approved. Congratulations. You're going to receive your CAQ number. Now, it'll say count is firm. They're going to give you a username and a login. And if you look down over here on the right-hand side, you're going to see under that username is that CAQH provider ID. See, Stan, what do I do with this? Well, that's really important. You want to provide this to your third-party provider, or you're going to use it the first time that you file with a particular, be it Blue Cross Blue Shield, be it Aetna, or just any insurance medically when you do it that first time. A lot of times some will send it, actually keep it on file if it's asked for, but a lot of times they send it so that insurance company knows, oh yes, we've checked that doctor, we know that their credentials are correct, and it helps your claim to move along instead of being delayed. Okay, so let's look at a few more things as we close out on this. 3 steps of credentialing maintenance. You must maintain this, whether this is the office manager or the dentist themselves. I would highly recommend that you'll get someone else to do this for you, so that practice dentistry. Let this person take care of it. The office manager is a good person. Very few offices have credentialing managers. Larger offices do. They're responsible for keeping up with your documentation and attestation. Okay, basically that you confirm that that's correct. All right. Manage that payer list. Manage your payer list to maximize exposure to medical insurance companies. Okay. How do you do that? Here's a good hint. If you hadn't already done this, this is something good to do. If you're getting ready to offer medical billing and you get ready to do dental sleep medicine or some other procedure, start collecting when your patients check out, all your patients you have a record now, go ahead and get them, ask for a copy of their medical insurance card. And they're going to say, well, why do you need that? And just tell them, say, that we're looking at possibly doing medical billing for some procedures in the near future. And that will begin to help you see what medical providers are in your area that are the most prevalent. Maybe it's Blue Cross Blue Shield. Maybe it is Aetna. Maybe it's some other company. That'll help you to get a good thing of that. And then that moves over to number 3, portals and resources. Know the available portals you can join with that provider where to provide your CAQH number. And if you plug it in, then they've already got it. Okay. Now, make sure that your provider credentialing information is accurate and up to date. It is vital for claim reimbursement. Again, it can be delayed, it can be rejected. If this is not completed, your claims may be held for approximately, believe it or not, 90 to 120 days. They must make sure that you're licensed and a provider for that particular therapy, service, or whatever you're offering. If not, they will not process that claim. Now, there are some insurance companies, they look at it and it goes in the trash can. Okay, it goes into a shredder. They just say, well, that's your problem. You didn't understand how to do that. Okay, let me say something about this if you hadn't figured this out yet. Dental insurance is a lot more friendly than medical insurance. They're two different animals and they have to be approached. That's why I want to say this to you. We provide a medical billing service, again, called Nexus Billing. We are very good at getting doctors good quality reimbursements and good numbers. And we would like for the opportunity to talk with you about that and to see if we can help you to do better on your reimbursements medically than maybe you're doing right now. Okay. Let's talk about a step-to-step maintenance plan. Create an office manager account. You can do that. So the dentist has an account, but the office manager can also create an account and they can be linked together so that you can keep a watch on that. We've provided you the email, not email, but the website address there. Manage users. This should be done quarterly. Add the date to your practice. Management software is reminded. So like if you've got Dentrix or you've got EagleSoft or whatever, make yourself little reminders that, hey, that's coming up so that you'll stay ahead of the ball game. Manage practice and list. Make sure the right people have privileges and that your locations are listed. So make sure that's correct. And export information, update, make sure you're updating this licensures every 2 years, that you don't let that lapse on you. One last thing I want to talk about is which payers need access. Okay, make sure that you go over that. You know who they are. Number 2, add to ProView. Add them to your ProView. See the next slide to find out how to open those credentials. I'm going to look at that for just a minute. And then number 3, you can't access CAQH. Then if they cannot access that, then some payers cannot access. Then you will need to know how to provide them your credentials. Okay, so like if it's an insurance company that's has their own process and they don't go through CAQH or Availity or any of these providers that give that information, make sure you find out how to do that and do it correctly. Okay. Number 4, big time. We'll make sure we understand this. Verify the information received. Never assume that since you gave them your CAQH number to that insurance company or sent them the credentialing form that you are set to get paid. Check back, verify that they received it, verify they have that number and that all things are in order. Adding to the provider list in CQH is just basically, and again, we're more glad to provide this for you, list of this. You go in there and you can go in there and provide each insurance company that you are dealing with, and that makes the process a lot easier for you in the future as you move along. Okay, I would encourage you to create a spreadsheet to list all the payers you work with, also and list all the information needed to access the necessary portals. How can I do that? What website? And their phone number and all that good stuff, so that you're constantly on top of this and you never fall out with any particular provider in your area that your patients are using. So let's look at this one more time. Gather, register, stay up to date, manage it, and make sure you're looking at your resources and you've got a good step on that. Okay. Now, again, I just want to thank you for the opportunity to share this information. We have found so many dentists when they first come to our company, to DreamSleep and to N3Sleep, and they're saying, "Well, I want to do dental sleep medicine," or I've been doing dental sleep medicine, and it's just not going out the way I thought it would. Can you guys help us?" Yes, the answer is yes. We'd love to come alongside of you, partner with you, and I just want to make this one note here about us. We're not like other competitors, and I'm just going to say it very carefully. We don't say, "Hey, let us show you how to do it." We don't hold anything back. We give you a proven system of over 25 years of experience of we failed so you don't have to. And our customers are doing big numbers. They do as much as 15 to 20 appliances a month, and providing help and the thing. We come alongside of you, we partner with you, and we truly give you customer service. You'll have me or one of our coaches that'll come alongside of you and have those Zoom calls with you each month. We come to your office, we provide that training. And if you're not happy with the reimbursements you're getting right now, let us send you some information about Nexus billing systems and see if we might can help you better. Steve, I appreciate the opportunity to share. Do we have any questions?
Stan, that was great. Thank you for being so detailed about what can be a tremendously confusing bunch of labels and acronyms and things like this. And so you were really able to make that much clearer for our audience. Thank you. Yes, and before I ask some of the questions that have come in, if you have a question for Stan, please type it in the chat box and we'll be able to get to that. I do have a few that have come in. Dental practices aren't really used to medical billing, up until the era of sleep apnea came along. I've been doing this for a long time, and medical billing hasn't even been part of my practice for as long as I've been doing sleep appliances. So now we're learning about a lot of other things we can code to with medical codes. So I think it's becoming more and more important. And so this is a very timely webinar you put on. And Stan, if you want to stop sharing your screen, you can get your face full on here. People can see that magnificent beard.
Sure. I don't know if they might want to or not. Let's see if I can get off of there and stop sharing. Let's see here.
Oh, I might have messed things up.
No, we're good. We're good. Right. It's just that I'm so used to that.
So here's a question for you while you're clicking on things. Can my dental practice file a medical claim without being registered for CAQH? Is that a requirement, CAQH?
You can file a claim, but I will go ahead and let you know that it definitely will probably most likely get caught up in committee. It'll get caught up in the committee process, and they'll look at it and say, okay, if they have to know who that dentist is, they have to know who that dental practice, they have to have their numbers and everything, and all that information is not provided on a CMS 1500 claim form. So there has to be, if they've contacted that insurance company prior to sending that claim, even then they have no way that all that stuff has to be verified, and they're not going to say, okay, well, send it to us and we'll verify it. They're going to go look at CAQH. They're going to go look at Availity, or they're going to ask you to go through their process that they have to verify you as a dentist to know that, hey, this person's qualified. So the answer to that, yes, you could claim it. It'll be rejected, and it's going to come back to you. Some insurance companies, like I will say this much, Blue Cross Blue Shield's pretty friendly. I've seen them send back a claim 5 or more times, and they'll say, hey, this is what the problem is. And then they don't know how to fix it, or how to fix it on the claim form, or what they're asking for, because they've just never done it before. And they'll do that for about 5 or 6 times. And after that, that's it. You're done. You're cooked.
Yeah. So, and I want to underscore something you made a point about. So you did say this, but I really want to make sure that people hear this, is that registering with CAQH and Availity, that's not the same thing as becoming in network. Right?
Yes, sir.
Yeah, you want to say that again for us all?
Yes. Thank you very much for bringing that out. I think one of the things we hear more than anything else when people are inquiring about our training and about our program, which we have a great program, we really do, and they'll ask about it and they'll say, well, I want to get in network, and we say, well, that's easier said than done. And sometimes they don't go, hey, today, Dennis, we're accepting you to come in network. They really don't want to. And what it is, but they will do it quarterly, but they never let you know when it is. And you just have to keep trying and trying. But then on the other hand, sometimes it's better to be out of network than it is to be in network. But that's basically, let's go back to what you said. Credentialing is providing that information so that it shows that you're qualified. But the second part, contracting, is saying, hey, okay, can we talk about a price that I would receive per case? Now, there's a big point that we made on the PowerPoint there is this, that when you go into the contract agreement, a lot of people are quick to do that. Don't be. Slow down. It's something that should be debated. It's something that should be bargained with, and you know, all the if, ands, and buts. Because if you agree for that, that's what you're going to get from there on and forever. Okay, it's not going to go up, and it's not going to go down. That's where it's at. And if you decide that you want to, you can do the right off the allowable amount, but you have to basically charge that, and you can't charge any higher.
Right. Yeah, so it's a contract, and you see, yeah, we've in our practice we've negotiated those, and I
Yeah.
tell you, Stan, they did come along and cut one of our big ones around here. Came along and said, "Well, we're going to pay you less now," and we said,
Oh, wow.
"It's less. It's a contract." They said, "Well, we're going to pay you less." So and then what are you
Yeah.
going to
That's when you got to say, hey, that's when you have to sit down and negotiate. Say, well, why is that? Why is that? And everything. I think that a lot of people don't know how to talk to insurance companies and everything, and we've got experience with that. I mean, we've done that over the year and everything. I've been on the phone actually with some people in dentist offices when they call insurance companies and they're asking about the VOB verification benefits, and they're asking about, have they met their deductible, all that, and we can kind of tell if they know what they're talking about or they're not sure, especially when somebody throws a G47 they throw that out and they're like, what is that? And or EA406 code, they have no idea. That person is like, okay, well, I have to put you on hold, But I'm just saying is that we can help with that negotiation process. We cover a lot of things that a lot of people that are doing dental sleep medicine training don't cover, and that's what's really helped us to be a leader in this area.
So one of the things you also pointed out is the ADA and our American Dental Association. I'm a big fan, but not everybody's a member. Require or recommend me to register with CAQH. I know it's a member benefit, or it's a benefit for every dentist. So can you say a little bit more about that?
Yeah, I believe that. I agree with you. I believe that dentists should be they should be registered. They should be a part of the ADA. But if you notice this, the ADA understands how important it is for a dentist to be registered with CAQH. So that's why they've made that bridge in their website and everything. And then there's another. I just want to throw this out there. A lot of dentists are not up to speed. That right now the ADA used to not have a lot of information on their website about sleep apnea. Now they've got a lot of good information that a dentist can pull from and everything to be informed and everything. But on the other hand, they're saying, hey, we want all of our dentists to screen for sleep apnea. And this is the thing I throw out. Well, if you're meeting that requirement, you're screening as the ADA gives some guidelines. What are you doing then? Are you referring them somewhere? Are you helping them? And I remember I've been a dental assistant for over 30 years, and I can tell you this much, that when Invisalign first came out, I remember people used to say, hey, do y'all do Invisalign? And we'd say, no, we don't, and everything. And they would say, okay, we would not see that patient again because they would go looking for it somewhere else. Well, dental sleep medicine is becoming that type of an animal or that type of a thing, and and everything. So instead of saying, well, let me refer that, you're referring that treatment, that confidence, and you could lose that patient. And also too, hey, let's keep that money in house, So I believe a lot of dentists that are scared or they're a little bit apprehensive. And yes, there are a lot of bells and whistles, this, as you know, but that's what we're here for. We've taken our experience. People say, well, how did you get involved in this? I didn't get involved in it because I wanted to. I got involved in it because as I was a dental assistant, and the dentist I was with back 20 some years ago said, hey, I'm hearing about this. I want to check it out. I would have never been exposed to it if it wasn't for that, you know?
Yeah, and and of course that's what our magazine, Dental Sleep Practice, is all about, is helping dentists see how they can be part of a solution for their patients.
Oh, yes, sir. It's going from, we know the oral cavity. We know what we're doing. We know to look in there for those signs and symptoms, but now we can take our care from that realm to the wholeness of the body. And because, from there, everything is systemic. So yeah, I'm a big advocate for that.
So, what happens if and actually, this is important for me too. Actually, right now, you mentioned updating my CAQH information every 2 years. Well, my license in Washington renews every year because I renew it on my birthday. And so, if I waited 2 years, it would look out of date, wouldn't it? And so, wouldn't I need to have somebody look at the CAQH, once a year at least? Why 2 years?
Yeah, we put that number in there, but different documents carries different times, right? I guess we were just throwing that out there. We might have put that in the wrong place on the slide, or I may have said it wrong. And I appreciate you bringing that, pointing it out. There's different things like your malpractice insurance, where you went to college, those things like that, they don't, but there's certain things that do, like you just said. So if anything runs out of date, then automatically when if they go to verify you, or they just decided to verify you, and you're filing claims with them, then all of a sudden what's going to happen is your claims are going to start getting rejected. Because why? You haven't got proof that you have the right credentials to provide that therapy.
Yeah, and as a clinician, I can tell you that we get emails all the time that says, it's time to look at your ProView. It's time to do your QA.
Exactly.
So they do automate that process a little bit.
Yeah.
Send you reminders, and so
I think that's a good. And let me just throw this in real quick. I think that's a good reason why the dentist needs to have the office manager or somebody in your office that handles that type of stuff, because you could put that email address in there and say, "Hey, you want us to send you reminders?" Yes, check that. I may not have mentioned that back in the presentation here.
Yep. So, and do you need a CAQH number to file a medical claim?
That's a good question. I think that you do, because well, let's back up. If they're a major provider and that provider is pulling from CAQH or Availity, yes, of course. But if they're pulling, they're not a part of that. There's some smaller companies. I don't like to call them smaller, but like, I don't believe Humanity. They may have changed, but Humanity used to not. If I'm saying that right. Yeah, thank you. I always say their name wrong. But if they may not be pulling from that, they used not to, then the dentist has to provide, go through their paperwork, or they have a submission online or whatever. So the answer to that would be no, if they're not. And you need to find out from the provider, what they and Blue Cross Blue Shield will tell you just like that right there. They'll let you know. And then sometimes they're not very friendly. I'll be honest with you. I hate to tell everybody, but you probably know that also, Doc. Insurance companies don't want to pay nobody, do they? So
they're not in the business of paying for healthcare, that's for sure. Yeah.
Yes, sir. Yes, sir.
So one of the things I caught my ear when you were talking is you said, well, sometimes if you're not signed in with CAQH and they can't verify who you are, they might just shred your claim and make it, it's your problem, you dentist, it's your problem to sort this out. But then later you said, well, if they're not a member of CAQH, so they can't use that service, but it's up to us again to apply to them and tell them who we are, and as opposed to them asking us or going to the site that we've taken the time and trouble to sign up with. So I don't like that double standard.
I don't either, sir. And here's the thing. I would say a lot of dentists, when they hear about dental sleep medicine, they're like, "Oh, this sounds good. I can see how that would help my patient." But when it seems like medical is always that wavering point where it says, "Hey, dental insurance is easy, but this medical stuff is just too complicated." It can be, and that's why I think that dentists should go with a third party biller, but not just there's bunches and bunches of them. You need one that has a good reputation. That's the reason I mentioned our biller, Nexus Billing. A lot of research, a lot of planning, and a lot of preparation went into this for us to be able to offer Nexus Bill and everything. Because we used to refer people to third-party billers. And hey, we teach medical billing. I teach it. I can come into your dental office and work with that team. We have modules. We have everything. But here's the thing. most don't have the time nor the staff or want to get involved in that. It's just easier for a third party, but it is some red tape, but it's worth it.
Yeah, I can tell you from experience, even with a third party, even a great third party, it still takes work on the behalf of the dental team. So training but it also gives the administration people a chance to contribute to the successes that we provide people when we help them breathe
Oh,
better
yes.
back time. Because
Yes, sir.
the clinicians, the dental assistants, the dentists, we get lots of kudos for somebody coming in saying, "Wow, I feel so much better. I'm not snoring. My bed partner's happy. I'm all the pluses." Well, that's fantastic. But if they weren't getting the admin stuff done properly, then that they wouldn't have maybe accepted the treatment. So the contributions of a proper admin, of a good billing system, of supporting the financial part of this decision that folks make to get an oral device, I think is something that's underappreciated. I believe that that's just all part of the teamwork, and working with Nexus Dental Systems is certainly a way to enhance that value of an admin person in a practice. So good for you guys.
Yeah, and let me just make a comment here real quick.
Yeah.
Is that one of the things that has happened to me over the years? I mean, I've been doing this for a while. But I've been all over the United States. We have offices. I've got clients. We've got clients all over the United States and everything. But here's the thing. We always encourage the dentists and the team when we're doing the training. Hey, is there anybody on staff that you think you might have sleep apnea? Okay. Or do you have a family? But let's take care of the staff and the family members first and get everything straight. And then we'll launch to the public. Okay. I have gone back to offices and people have walked up to me. I can't remember all these people. And I'll be in the waiting room or I'll come in the front and people that are patients or staff members will come up and hug my neck and just say, thank you. And man, that's a good feeling. It really is, to know that I empower other people to change people's lives every day. And that's what that's our motto at DreamSleep. We change lives and save lives every day.
Yeah. That's a good place. We're a little over time, and so we don't want to keep people waiting too long. We didn't get to quite all the questions, so if you typed a question in the chat, we'll certainly get back with you. And Dan, I love what you said just there. You hardly ever get a hug around your neck for a fancy new filling on the distal of number 20, but you get a lot of from somebody who wakes up in the morning ready to go for their day. So fantastic.
That's right.
For you guys.
That's right.
Thanks again for your time today, your expertise. Clearly, you're a master at this part of our field, and it's wonderful to hang out with masters. And I appreciate the support of Nexus Dental Systems for this webinar. And thank you from Dental Sleep Practice Magazine. And have a great day.
Thank you.